Is your low back tight? Does it just feel stiff every morning? Or maybe it's after you've sat for a while, it just gets really tight. It's hard to get worked out. Or maybe you're somebody that works out all the time. You walk a lot, you're very active, but just certain parts of your low back never seem to loosen up. If so, this video is going to be great for you. I'm Dr. Putney with Wellington Family Chiropractic. And today I'm going to talk about an exercise that I often prescribe for my patients with low back stiffness or when their low back gets rigid. It's a really easy exercise to do, and over time, incrementally can really improve the range of motion in your low back and get some of that stiffness that you feel. This exercise is called the lumbar cat-cow or a cat-cow exercise. You've probably heard of this before. It's not uncommon, but I find that a lot of people don't do it very well. So what I'm going to do is go over how to do it really well and how to really focus in on the lumbar spine itself. So for most of my patients, what I will do is I will have them grab some sort of band, or you don't necessarily need a band. Sometimes you might just use a belt or a sheet that's wrapped up. And what we're going to do is we're going to place that on a specific portion of the spine that we feel is the stiffest. That way we're getting feedback to move those segments. So I'm going to show you first how to do the exercise, and then I'll show you how to add the feedback. So the exercise itself, you just get in the quadruped position. And then what you're going to do is you're going to tilt the spine down, and then you're going to bring the spine up as far as you can, down, and then back up. Now, what we find for most patients is they'll move a certain portion of their spine really well. So a lot of times my low back patients, I'll have them do this exercise, and you'll see all the movement happening in their upper back or maybe just below their shoulder blades, but their low back doesn't move at all. So what we do in that case is we add the feedback or the loop, and we're going to wrap it right around the portion we want to move and then just hold it. And so that little bit of pressure gives my brain the feedback it needs to make sure all the movement is happening at that segment. So this feels completely different than it did the last time I did it, because I'm moving right at the segment where the band is touching. So the band is not there to resist you. It's to give your skin the sensation of feeling something touching it to tell your brain that's the segment we want to work. So when we do this exercise, you want to go as far as you can and then go as far as you can both directions. And you're not using all your might to push into the band. You're just trying to get to your end range, and then you can move the band up a segment or a vertebra and work that level. But what you'll notice is you may have tried this exercise before and felt like it didn't do much, but when you add some feedback to the segments where you feel the stiffest, that little bit of skin sensation and feedback allows you to target those segments of the spine, and moving them into extension and flexion over time will loosen that up. So typically what I have my patients do is a set of 20 repetitions, and we'll do that 2 to 3 times a day. And it's not a miracle, but if you do that every day, you can really get into those stubborn spots that don't move well, and over time restore better range of motion. And typically with better range of motion, your low back's going to feel better throughout the day. You're going to be able to bend down and touch your shoes and put your socks on with less pain. So a lot of these functional activities that drive us nuts begin to get better once the spine and those joints begin to get better movement throughout the day. So the lumbar cat-cow with a little bit of feedback, put it right on that area where you feel the stiffest, and just work into those segments. Hope this helps, and I'll talk to you soon.